Before fitting any mandibular advancement device, it is important to inspect the patient's mouth. Check for any loose teeth or any abnormalities in terms of the upper or lower jaws, and also check the positioning of the lower jaw relative to the upper jaw. Check also the maximum advanced position of the lower jaw, the normal position, and the receded position advancement. From this you can determine how much advancement will be required with the mandibular advancement device. Unpack your SomnoGuard AP. There are two pieces, the upper and lower trays, and the plastic bag containing the adjustment screwdriver and adjustment screws. The upper tray for the SomnoGuard is fitted first. Place the upper tray in boiling water for 3 minutes until the thermoplastic inner plastic is completely soft. Remove the upper tray from the boiling water. Test that it's not too hot for the patient. This can be done on the skin of your forearm. Fit the upper tray to the patient's upper teeth, ensuring that the front teeth are as close as possible to the external edge of the hard plastic outer part. Press the upper tray onto the teeth of the patient. The patient should not bite down upon the tray at this point. Ensure that there is a medium-sized imprint formed at this stage. The lower tray of the SomnoGuard AP is fitted secondly. Firstly, take the lower tray and choose the shortest screw from the adjustment screw packet. Fit the screw to the lower tray and screw it in until approximately 1 mm of the screw is protruding from the front edge of the lower tray. The lower tray is placed in boiling water for a period of 3 minutes until it is softened. Meanwhile, the upper tray that had been fitted previous to this is cooled off in cold water. Take the lower tray from the boiling water and fit it together in the C channel of the upper tray. They will slide together as you see. Test the temperature on your arm that it is comfortable for the patient. The upper tray is positioned in the previously formed impression upon the upper teeth of the patient. The patient must not bite down at this point. Ensure that the upper tray is positioned in the previous impression. The lower teeth of the patient must be positioned in the boiled lower section with the positioning as far forward as possible to the hard outer edge. The patient can then bite down as hard as possible into the lower tray. Press down around the gums of the patient, forming any of the thermoplastic around the gum of the patient. Remove the whole device from the patient's mouth. Separate the two pieces and cool off the lower tray. Place the upper tray of the AP back in boiling water. It's important that the water is actually boiling. The upper tray will need to stay in the boiling water for about 1 minute. The lower tray is placed in the cold water to cool it off. Now we're going to trim any excess material from the lower tray that has cooled off. Take the lower tray from the cool water, shake off any excess water and just dry it off. With a sharp pair of scissors we're going to cut off any protruding material. It's important that you only cut off the protruding material that comes off vertically from the face. Don't take it off the end or the length of the impression that has been formed. Just check that the edges are smooth. The upper tray has now been in the boiling water for about 1 minute and should be soft. Slide it together, fitting it to the lower tray. We will now complete the forming of the upper tray impression. Place the complete SomnoGuard back in the patient's mouth. Locate the upper tray with the original impression carefully over the teeth of the patient. Once in place, the patient can bite down firmly into the upper tray. Press lightly around the gums of the patient and then allow 20 to 30 seconds for the SomnoGuard to cool off. Do not remove it before it has cooled slightly. When you remove the SomnoGuard from the patient's mouth, lift it from the back of the mandibular device and prise it up off the teeth from the back. Remove the SomnoGuard from the mouth of the patient. Cool off the SomnoGuard in cold water. Remove the SomnoGuard from the cold water. Slide the two pieces apart. We're now going to trim off any excess material that has protruded from the upper tray. First take the excess material off the front edge and the front face of the upper tray, and then off the back sections of the upper tray. You'll see those little bubbles of plastic that have extruded out through the holes in the hard case. It's important that these are trimmed off because these can prevent the upper and lower trays from sliding freely and making the lateral sideways movement. So check that there's good lateral sideways movement and there's nothing hindering that motion. If you are satisfied with the fit, you can now check the fit in the patient's mouth, but make sure you're satisfied that the fit is good. If it is not good, you can repeat the fitting procedure for the upper or lower trays or both as many times as you like in boiling water. So the soft material can be softened again an indefinite number of times in hot water. This completes the fitting of the SomnoGuard AP.